Hello friends, welcome back to Lomedics. In this video, I am going to explain about circle of Willis. Circle of Willis, it is the circulatory anastomosis. Anastomosis means one blood vessel connected with other blood vessel, that is anastomosis. Here, one artery is connected with other blood vessels. These kind of blood vessels supply the blood to brain and surrounding structures of brain. It is discovered by Thomas Willis, that's why it is called as circle of Willis. Circle of Willis is a part of cerebral arterial circle. These cerebral arterial circle give the blood supply to brain. Many arteries are give the blood supply to brain, but they are not the part of circle of Willis. The circle of Willis is also called as Willis circle, loop of Willis, and Willis polygon. This is the circle of Willis. Here, one anterior system is present and one posterior system is present. These two systems are connected by posterior communicating artery. The main function of circle of Willis is maintain the blood supply to brain. I already told circle of Willis is a part of cerebral circulation. It is located at the base of brain around the optic chiasma and hypothalamus. Optic chiasma is the optic nerve crossing area. The circle of Willis composed of anterior communicating artery. It connects the two arteries. They are right and left anterior cerebral artery. These anterior cerebral arteries are the branch from internal carotid artery, right and left internal carotid artery respectively. This is the anterior system. Right and left vertebral artery join and form the basilar artery, and it gives the branch of posterior right and left posterior cerebral artery. This one is the posterior system. The anterior system and the posterior system are connected by posterior communicating artery. Here, two main blood vessels are present, internal carotid artery and vertebral artery. Two internal carotid artery, that is right and left internal carotid artery, and two vertebral artery, that is right and left vertebral artery. These arteries are the branch from aorta. The aorta has three branches: brachiocephalic artery, left common carotid artery, and left subclavian artery. The subclavian artery gives the branch of vertebral artery. Left subclavian artery gives the branch of left vertebral artery, and right subclavian artery gives the branch of right vertebral artery. And the common carotid artery gives the branch of internal carotid artery. Right common carotid artery gives the branch of right internal carotid artery. Left common carotid artery gives the branch of left internal carotid artery. I already told here two systems are participating. One is posterior system. It is supplied by vertebral artery, so it is called as vertebral system. And anterior system, the anterior system is supplied by carotid artery, so it is called as carotid system. Now the vertebral artery. The right and left vertebral artery form the basilar artery. It gives the branch of posterior cerebral artery and superior cerebellar artery. The posterior cerebral artery gives the blood supply to occipital lobe, and superior cerebellar artery gives the blood supply to cerebellum and part of the midbrain. But superior cerebellar artery is not a part of circle of Willis. Posterior cerebral artery is the part of circle of Willis. Now anterior system, that is carotid system, it is supplied by internal carotid artery. It supplies to anterior aspect of brain, so it is called as anterior system. The internal carotid artery gives the branch of right and left anterior cerebral artery. It supplies the blood to middle surface and upper border of frontal lobe, and it is also supply the front fourth fifth of corpus callosum. The right and left anterior cerebral arteries are connected by anterior communicating artery. Middle cerebral artery also give the blood supply to brain, but it is not a part of circle of Willis. Till now I told about anterior system and posterior system. These two systems are connected by posterior communicating artery. The main function of circle of Willis is to maintain the blood supply of brain. If any block in here, blood passes from this way and supply to this area, and blood passes from this way and supply to this area. So the brain get blood supply from the circle of Willis. Did you think then how the stroke is affect the person? It is due to the blood supply passes from these vessels are not enough to the part of brain. So it leads to ischemic stroke. It is the applied aspect of circle of Willis. Stroke, there is two types of strokes are present. One is ischemic stroke and another one hemorrhagic stroke. Ischemic stroke is due to thrombus or embolism in the blood vessel, and the hemorrhagic stroke is due to any trauma or breaking of aneurysm. Aneurysm is the ballooning of blood vessel due to the weak area in the blood vessel. If the person have aneurysm and also hypertension, means the high blood pressure passes into the aneurysm and it leads to breaking of the aneurysm. So the person may affected with hemorrhagic stroke. The blood directly passes into the cranial cavity, that is called hemorrhagic stroke. Another one is subclavian steal syndrome. If the subclavian artery is stenosed, means the blood from the circle of Willis passes via the vertebral artery and the blood is stealed by subclavian artery. That's why it is called subclavian steal syndrome. If any problem in the circle of Willis, pre-syncope, syncope means fainting, and memory problem and blood pressure differential between the arms. These are the symptoms. Thanks for watching.